Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, we head to New Zealand. I interviewed Dr. Judy Melinek, a forensic pathologist in Wellington. Dr. Melinek left San Francisco early in the pandemic to take a job in a land without COVID. Now New Zealand is experiencing a surge in Omicron cases. Let's listen. Dr. Judy Melinek, it's so great to have you back on Public Health on Call. It's been a while, hasn't it?
It has. It's been almost 2 years, actually, since you first interviewed me, which was at the start of the pandemic.
Right. Now, back then you were in San Francisco working as a medical examiner, but then you moved.
I moved to New Zealand with my husband, TJ, and 2 of our 4 children. And that was in July of 2020. So it was at the point where we were at the first peak in the San Francisco Bay Area, but New Zealand had come out of its lockdown and had 0 community cases for several weeks.
And you moved to be a medical examiner in New Zealand, is that right?
Correct, except they don't call it a medical examiner here because they have a coronial system. So I am a forensic pathologist working for the coronial system through the Ministry of Justice.
And so what was it like to enter a country that had no cases? I'm imagining they didn't just take you right from the plane to your apartment.
It was exactly as I expected, but it was surreal to come out of lockdown. So what happened was at the time, they had a 14-day managed isolation period where myself and my husband and 2 daughters, we were in a hotel room and we could not leave the hotel room except for very regimented periods of exercises that we got certain times of day. But otherwise, we were pretty much in this hotel room for 2 weeks. And during that time, we got the food delivered to our door. We got interviewed every morning and tested for our body temperature. And we received 2 PCR tests for COVID-19. If I recall, one was at day 5, and then the other one was at day 12, something like that. I may be wrong with the numbers, but it was at the start of the isolation. And then again, right before we were allowed to leave isolation. And once those tests came back negative, then we were allowed to leave and join the community, which was just like going back to 2019. It was normal life. Schools were in session. Nobody was wearing masks. Everybody was walking around like everything was normal. And it was weird. It was weird after being so many months in lockdown, not only the 2 weeks in managed isolation here in New Zealand, but remember prior to that, we were in lockdown in the San Francisco Bay Area for several months.
Right.
And the girls could not be in school and they couldn't socialize. And we were doing everything through social distancing with constant masking. So it was very, very weird to go out into the community with no masks and nothing, no mitigation needed because they had stopped COVID-19 at the border.
But you got used to it eventually.
We did. I mean, it was fantastic, to be honest. We've been here 2 years now, and New Zealand has had, at least objectively, when compared to other countries, one of the best responses of all the countries in the world to COVID-19. And part of that comes from the fact that it had this elimination strategy early on in order to stop it at the border with managed isolation, testing, masking, contact tracing, and all of those layers of the Swiss cheese model, as they called it, in place. And because of that, we have had one of the lowest per capita death rates in the world. To date, we've only had 184 deaths from COVID-19. With a population of 5 million people, we've had about 500,000 cases, so about 500,000 documented cases, but only 184 deaths. And part of that is because the elimination strategy delayed the introduction of COVID-19 into the circulation up until the point that we were so highly vaccinated.
So I want to get to that. So you had an elimination strategy where there are no cases in the country, but that comes at a cost. You have all these different procedures at the border. Plus, if a case makes it in, then everybody's got to shut down for a while. And throughout that time, there were people who were saying it's too costly, right? And so the country had to decide when to open up. So what was that like as you heard, kind of these debates happen?
So I should say that I'm not part of that decision-making process. I work as a forensic pathologist doing autopsies. I'm not part of the Ministry of Health or one of the advisors to their strategy. I've been basically just a citizen here, living the strategy and learning from it from just like everybody else, like every New Zealand citizen. We learn about it during our 1:00 press briefings every single day. And so that has been the way that most of the information has been disseminated on a daily basis. To answer your question, it was really impressive. I'm still impressed by it, that yes, it did come at a cost, and there was resistance from several groups, including opposition political parties that weren't in power, including a lot of business interests that wanted things to open back up, specifically from the hospitality sector that was suffering because New Zealand has a very large tourism industry. But the government quieted many of their concerns by supporting them in other ways. So, for example, those hotels that could no longer have tourists were instead housing people who would otherwise be out on the street and not capable of being housed. They were also housing managed isolation. So not only in Auckland, but also in Rotorua and in Christchurch, they converted several hotels to managed isolation facilities so that the hospitality industry had some money coming in. And there was a very strong encouragement for national tourism, not international, but to have Kiwis stimulate the economy internally because we could. And that really helped out a lot of industries. But, there's always going to be some opposition and there's a cost benefit to it. I argue that the lack of death is worth the expenses, the financial expenses, and actually the GDP has done quite well. So economically, we did not suffer as much as countries that let COVID-19 run rampant to the point that it overwhelmed the healthcare system or it caused so much death and destruction that capacity to maintain businesses was affected in other ways.
Right.
And that was more of an issue during the Omicron wave.
So that policy, though, eventually did change, right? After vaccination, as you said, country basically said, let's stay isolated until we can really get a high level of vaccination, and then let's open up. And so how is that process rolled out?
So on the 2nd of December, the government transitioned to what's called a traffic light system. So instead of looking at lockdowns, which is a very harsh elimination type strategy, it transitioned more to a control strategy, especially since at that point, we had quite a significant number of people who were vaccinated. So if we look at our numbers right now, more than 95% of those 12 and over have completed 2 doses. 73% of those who are eligible for the booster shot for the 3rd dose have been boosted. And we, on average, are putting in about 2,000 boosters a day. So there has been a real public health effort to focus on the vaccination, but that's not the only strategy. The other strategies that are in place to try to limit the damage of Omicron, we're at the top of a peak right now, is mandatory masking in indoor spaces and vaccine passports. So we have to prove our vaccination status in order to have access to certain venues.
Got it. You are seeing the cases now, and you're seeing some more deaths. How has that affected New Zealand's sense of the pandemic? Was it well anticipated that this would happen? Is it something that is surprising people? Are people wondering whether they should have stayed locked down and isolated? What's the mood right now?
The mood is somber, but in many cases, understanding of what the strategy is and where we're going, just because whether you agree with the government strategy or not, and there's a lot of debate on social media and also in the public sphere and in the news agencies have been pushing back. As I said, opposition political parties have been pushing back. We also just recently had protests in Parliament with people who were not happy with the mask mandates and the vaccine pass mandates. There is opposition, but at the same time, overwhelmingly, when polled, the majority of New Zealanders support the government strategy, have a very high trust in the government's strategy and plan. And I think that comes basically because of communication. every single day. We have either a press conference or a press release. There's information that's disseminated through the press and through the government website, which is covid19.govt.nz. And I recommend anybody look at that because it's a fantastic website in terms of teaching public health strategy. Communication techniques are the key. They're the cornerstone of public health information.
So you feel, for example, that you and anyone you interact with in New Zealand is sort of operating from the same basic information about the status of the virus. There's not multiple alternate realities people are dealing with that? Or do you have all the misinformation that, we see, for example, in the United States coming through, like actually, COVID is not that serious a disease for anyone or, that kind of thing?
I wish it were the case that we had no misinformation here, but yes, there is quite a bit of alternative media strategies. There's social media sites that have been actively spreading misinformation and disinformation. So I do encounter people I have to constantly debunk, not just friends and colleagues when I meet them and we talk about the pandemic and our response, but I'm online. As you know, I'm very active on social media. So I will get accosted or challenged. And then I bring up the actual data and I bring up the actual support from peer-reviewed literature. Because what else are we going to do, right? We have to speak out for reality. And as data scientists, as people who live their lives trying to make the best decisions possible, not just for our patients, but also for our families. I'm an evidence-based mom, not just an evidence-based physician. I want the data. And when I hear something, I want to check it up and I read the original literature if I can get my hands on it.
Right. And so somehow, even amidst misinformation, the balance in the country has kind of favored a consistent public health message.
I think the balance in the country has favored a consistent public health message because of the efforts of a core group of really dedicated professionals, not just in the government, but also adjacent to the government, other scientists, people like Susie Wiles and Michael Baker, and researchers and epidemiologists in the field who are just brilliant science communicators and can bring that information to the public through various means, whether it's animation and drawings or brochures, materials that's being disseminated. And the government has been pretty good at working together with those science communicators to have a consistent message.
So with cases and deaths going up, how has the pandemic started to affect your work as a forensic pathologist?
In two ways, primarily. The first way is that when someone dies suddenly and unexpectedly, it's not unusual that there might be a question about whether they had COVID-19. So we're going to need to swab them and do an autopsy in some cases to see whether the virus has affected their organs, like their heart or their lungs. So then we have to decide whether, if they come back positive, whether it's going to be on the death certificate under cause of death, or it's going to be under other significant conditions contributing to death, or if they died of something totally unrelated, for example, a result of trauma, it might just not be on the death certificate at all, but it'll be reported as a COVID-19 case, but not a COVID-19 death. So that stratification happens as a result of a forensic autopsy. The other way the pandemic has affected us is with such a highly vaccinated population in New Zealand, the temporal association between having had a vaccine and then circumstantially just happening to die close in time to that, the likelihood is higher. So there are questions that family members or coroners have about whether a death that is 2 days or a week or 3 weeks after a recent vaccine is a result of the vaccine or possibly a result of some sort of underlying condition that's unrelated to the vaccine. And so that can be answered also in some cases with an autopsy. Usually it's a review of the medical records that can answer that. But in some cases, we do need to perform autopsies.
So it sounds like you are getting busier, but at this point, unlikely to see the kind of mass casualty event that COVID became in the United States.
I would hope that that's the case. But again, we don't know where the next variant's going to lead us. And, we have to continue being vigilant and continue to mask and contact trace when necessary and test each other so that we don't go out if we're potentially infectious. So that's the next strategy for New Zealand, is focusing on masking and on mitigation techniques to test and to isolate yourself if you're symptomatic.
Dr. Melinek, it's great to see you, and thanks so much for joining me.
Thank you for inviting me.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.